Hi, everyone. Thanks for being here today for Is Your Team's Mental Health Flourishing? A conversation with HealthStream and CredibleMind. The mental health crisis for healthcare workers isn't going away. In fact, it's growing. Recent study for American Hospital Association found that 93% of healthcare workers reported stress, 86 anxiety, 77 frustration, 76 exhaustion, and burnout, 75 said they were just overwhelmed. So without a support system, employees are left to manage their mental health on their own, or for some, never manage it at all. So today, we're going to talk about how leaders can have a positive impact on their staff's well-being and the necessary factors that make up an environment where mental health can flourish. Supporting our conversation today, I'm thrilled to welcome Dr. Deryk Van Brunt, clinical professor of health informatics at the University of California, Berkeley School of Public Health, CEO of HealthStream's expert partner, CredibleMind, and president of the Healthy Community Foundations. Deryk, thanks for being here.
I'm thrilled to be with you.
So flourish. Now, that's a fresh word to categorize mental health. Tell me more about what it means and why we should expect to hear it more often.
Well, as everyone knows, we are in a national mental health crisis. And for the vast majority of efforts that we're all making out there, we've kind of just been playing defense. We're sitting there with a reactive system of care with some therapy and medication management and somehow expecting that's going to carry the day, and it won't. So what we need to do is be much more aspirational and help people flourish in their lives. Flourishing is a really interesting word. It sounds a little highbrow, but the idea is that people want to lead a good, fulfilling life. We use words like have more meaning and purpose. And there's a whole science to flourishing. There are basically, for the most part, there are different philosophies, 5 major elements: emotional and psychological regulation, social connectivity, a sense of meaning and purpose, and this idea of feeling like you're part of something bigger than you. It could be a faith, it could be what's called a contemplative practice like meditation. When people have those 5 things going on, they report on validated scales feeling much happier in their lives. And so for people working in corporate America, we need to shift our thinking from just a reactive system of care, and we need to do that, and we need to manage mental health, but we also need to start introducing flourishing into our populations, and there are tools to do that.
Yeah. So leaders or managers, we're talking about how they could maybe build that more positive workplace culture. And it certainly does start with normalizing talking about mental health, but we also have to do that addressing of the existing environment. So what are some signs that a team might be flourishing, and how can leaders harness that opportunity?
So, there's a guy named Corey Keyes there over at Emory University, and he has this great graphic where, someone can have a mental health condition or no mental health condition, but the other line on the graph, if you will, it's a 2-dimensional graph, is flourishing and languishing. And I'm saying this because that's sort of the languishing is the opposite, if you will, of flourishing. So how do you know if your team is flourishing? Another way to look at it is, how do you know if they're languishing, right? So it's kind of like, where are you on the scale? So there are traditional measures like productivity, turnover rates. So, if you have high turnover rates and productivity is kind of, barely, not really improving, these would be signs that there's languishing going on. But there are other much more subtle kinds of signs around a team flourishing. When you have a team where people feel like they have each other's back, they're thanking each other for getting things done. They have a sense for what their department is doing and the contribution to the organization, or even better, in the world. There's an energy associated with groups that are flourishing, and they're flourishing on an individual level, which means they understand their role and they like it, and they're flourishing as a group. And you can feel the buzz when it's happening.
I love that. Feel the buzz. Such a good sign of a happy workplace culture. And sometimes it's hard to really feel that unless you've experienced it before. So I appreciate the examples that you've shared there. One of my favorite questions to ask in these videos of our leaders is, what advice would you give to aspiring leaders who want to make a meaningful impact on their staff's well-being?
There are several things that someone can do. I think one is lead by example. So it's very important. A lot of times our organizations will provide tools and things like that, but they don't use them. They don't talk about stories around them. And we found that the partners that we work with, where leadership says, hey, I took an assessment and I learned this about myself. I'm not talking about, really deep details about their personality, but maybe that they were moderate on a scale of risk for burnout, And so we have an example where one leader of a department took this burnout assessment, found out that they were moderate to slightly above moderate risk, found some resources that were helpful, and shared that with the group. Now, the power of that message is so big. One, there's this, you can trust this system. I'm doing it. You're not going to be penalized for doing it. We're not looking at your data. There's that whole thing. Because building trust is what a lot of this is about. If you don't have an environment of trust, it's going to be very hard to show that you care. It's going to be very hard to get engagement. So I think leading by example, I think that offering tools that are concrete to people. So this can be newsletters, it can be courses, it can be different kinds of tools, but it's very important when you look, at surveys of how employees think and what they're looking for. They say flat out, they're looking for their leadership to show that they care and provide them tools. And it's very funny because on the one hand, the trust factor is not strong, but they want it anyway. It's important to them that they have it. So making tools available, I would say be very patient. It's not about taking something and throwing it at everyone and somehow it's going to make great change. People need help when they need help. It might be tomorrow and it might be in 2 years. So you need to be steady. You got to have like a drip, drip, drip kind of a campaign. You're there when they need it in different form factors. The next thing I would say is keep in mind this concept of sort of population-based mental health. Mental health, in the old days in the physical health world, someone might go get a quadruple bypass surgery, get checked out a week later, and go right back to not exercising, smoking, drinking a lot. Today, not so much. We take seriously prevention and early intervention. So our organizations can do the same thing in the area of mental health. You want to, one, provide tools that are evidence-based that provide early intervention. Two, maybe identify Providence Health, for example, a large 50 hospital health system. They have what they call ambassadors. These are people, they're allowed to use some of their work time to see if they recognize and become familiar with resources and point their colleagues to resources that can be helpful. So basically what you can do is build a culture of trust, a culture of opportunity of resources that are not just punitive therapy and medication management when you have those needs, but tools that are available earlier. And I'm going to share one more, which is kind of my favorite. It's the simplest thing in the world. We started doing this in our organization at CredibleMind. And that is whenever we have a larger department kind of meeting, typically like people that work with some different functions all together, we start with a bunch of shout outs, meaning it's an opportunity for people to recognize the contributions of others. So maybe you're on the sales team and someone really helped you out getting prepared for a meeting. Maybe you're on the technical team and somebody, got all this research together for you. And I was a little skeptical when someone suggested that. I so highly recommend it because what happens is the whole team, it's not at all forced. We are thankful for the people we work with. We do have everyone's backs. And when you recognize it, it just feels, one, exhilarating, and two, you're that much more likely to do it in the future when someone's asked you to help out over the weekend or whatever that is. So these are concrete things that you can do. And of course, to stay on topic, if you can provide Flourishing, I know that HealthStream is going to be offering a Flourishing course. If you can provide Flourishing, that's like playing offense in a football game. You don't want to just play defense. Make sure there are tools around helping your team flourish. That's going to go a long way towards building the kind of team you want to have.
A well-rounded approach. Thank you, Deryk. Thank you so much for this insightful and knowledgeable conversation today. A quick conversation, but sometimes those can be really impactful. So thank you for donating your time to talk about this. And for those watching, we hope you'll share this information with others at your organization as we all work together to foster a culture of wellness and inclusivity and improve care outcomes. Thanks for watching.
Thanks for having me.